This is Ali Ajmal, your psychologist. Today we are going to talk about gender identity disorder, or we also call it gender dysphoria. Okay, well, before I discuss this issue with you, let me make it clear that gender identity disorder or gender dysphoria, this disorder is having diversity in diagnosis across cultures. Even in some cultures, this is not a disorder anymore. But in other cultures in this world, people are having some stigmas, some other kind of social or moral issues associated with the symptoms of this disorder. That is why in these cultures it's still a disorder. Okay, what is gender identity disorder? What is gender dysphoria? These two things are one and the same. In different diagnostic criteria, we call it either gender identity disorder or gender dysphoria. Okay, a person is born male. He is fine. Physically, he is okay. He is healthy. Physically, mentally, he is fine. And by the way, sexually, he is fine. He is having no issue either with the organ size or with the potency, sexual potency, or any kind of problem he is facing, no sexual health problem. He is full-fledged male. But because of his mind, he is not satisfied with being male. He considers himself a female. He doesn't like his male sexual organ. He does not want to behave like male. He does not want to dress up like male. Contrary, he likes to be female. He is more comfortable with female identity. He is comfortable with being a female in body. He is male, by the way, a perfect male with no problem. But because of his mind, he is not satisfied with it. He wants to be a female. Okay. And likewise, if someone is born female, she's fine, bodily, everything, she's okay, she is a typical female. I mean that she's having a typical female body, but she's not satisfied with his gender, and she considers himself a male. Yes, himself, because she calls it this way. In different cultures where we don't understand this condition, such kind of people are living miserable life. Even their families are abandoning them. Yes, they are abandoned by their very family, because their families think that they are bringing bad name to these families, and society is also not dealing well with such kind of people. In short, in some culture where there is no awareness, such kind of souls, such kind of people, they are unable to attend school. They are deprived of their basic rights of education and health and many more. Their life is just miserable just because of this disorder. People don't understand that those people who are suffering from gender dysphoria or gender identity disorder, it's not up to them. They are not able to think the way you want them to think. They cannot become male if they are having male bodies. Well, understand, the people of the world should understand that it's their problem, it's all in their mind, so they cannot change. Okay, some people ask me, doctor, many people are doing it just for fun or entertainment. I agree with you, there are few people who just don't want to be into their birth gender. Well, this is one thing, but what these people are doing, to which I am referring to, well, it's not up to them. They cannot handle themselves the way you want them to be. Okay, so I want to address the families and I want to address such kind of people. Well, don't lower your self-concept. You are having some problems, and the families and the society should understand that they are suffering from some problem. In some culture, in other culture of the world, people are just accepting them because they are educated people, because they know that it's not up to them, they are unable to do that. So the cultures where such kind of people are not acceptable, I would rather appeal that you should be little sympathetic toward them. And as far as the families and these people are concerned, don't lower your self-esteem, don't have some depression. You should consult some psychologist. Maybe you can be cured for this symptom. This symptom has some genetic predisposition. Sometimes it's curable, other times these symptoms, this problem is not curable. Well, in either case, you need to consult some psychologist. I am not saying that you are mentally sick. No. What I am suggesting that maybe you can be able to come up with the expectation of your parents, or maybe we can convince your parents to change their minds. In either case, don't be depressed, don't stress out. If you are having any kind of depression, stress because of this condition, you need to consult some psychologist. You don't need to spoil your life. It's not up to you. I am with you. Yes, being an expert, I am with you people because I understand your condition, which most of the people maybe they don't understand. Just improve your self-concept, and if you are having some kind of depression, just come out of it. And if you can't come out of this kind of depression due to your gender issues or some family problem, you need to consult a psychologist. But people of the world, please be sympathetic towards them. Please let them live their lives. Thank you very much.